So technology in surgery in general is for two things. One is to improve outcomes, both in diagnostic as well as in treatment. And the next emerging place for technology is training of both medical and paramedical staff. So in diagnostics, we have excellent technology that has come up with AI, where you don't need too many radiologists these days as well. But the technology is far advanced that you can convert this technology into your operating theater for your planning of your surgery, to understand your pathology better, whether in the brain or in the spine. And you have many holograms and various other technology that's coming up in the future, which is going to help you to be able to see things in a much more three-dimensional way, and will help you also to understand the pathology in a much more meaningful way. So this is some of the emerging technologies that's coming up for the future. So in the operating theater, the most important thing that we all want to understand, we all want to follow, is safe spine surgery, where you want accuracy, you want superior outcomes, you want safety, and you want something that's repeatable. So we take everything, every precaution in your patient selection, in understanding your pathology, in using the technology. And in this boot camp this morning, we saw all those technologies which are there, which can be translated into your operating theater in various forms, like whether you use an O-arm, whether you use a robot, whether you use a 3D C-arm. So your technology can be transferred, your diagnostic imaging and planning can happen there. And you can be very, very specific in terms of looking the neural structures, as accurate as that. So this can be augmented through your microscope. So your microscope, for example, the advanced microscopes, you can have color coding. You can have your tumor marks delineated. You can look at your vascular flow. You can look at aneurysms. You can look at AVMs in the spinal cord. So many things that the technology will allow you to see real time. So this is how far we are going. And we're having many platforms for this. The augmented platforms in terms of the Google Lens, the Microsoft Lens, and also the Vision Pro. I'm not sure if any of you have used this. I was recently abroad and I went and had a demo of the Vision Pro Apple. And it's really going to change the way we look at anatomy. The way you look at your whole body, the way you study anatomy is going to change completely. So these technologies have all been used by us, and we have this whole gamut of things in our operating theater. Microscope, navigation, robot, aspirator, neuromonitoring, endoscope, drills, bone scalpel, RF ablation, exoscope. But they're all standalone technologies which have value by itself, but value together, because they don't talk to each other. You know, each company has a different technology, is patented, and the patent is not to the next company. So they all work differently. So the communication issue is there. And you have a very crowded operating theater with wires everywhere, where you have many technologies which work at different forms, and you need somebody separate to work them. What if you have all of this into one? Imagine you have a neuromonitoring, you have your X-ray, you have your navigation, you have your robot, and you have everything together. And yes, we have this technology already. NuVasive has something called as Pulse TM, which is not yet available in India. And you have all of this in one place, and you have these monitors. So there are 3 different consoles which can be operated. One, your technician can sit outside the operating theater, can look at the OR monitor, and representative of the company can see the technology from his place. A neuromonitoring physiologist, neurophysiologist can monitor from our office. And all this is cloud-based, and it's all wireless. There's no wires. So as Steve Jobs says, technology by itself doesn't make leaders, but technology only amplifies true leaders. So this cannot replace your skills or your knowledge or your technique. This is something that's going to amplify what you do. But things always go wrong and can go wrong. And time is the essence. You know, we are all having fast-track doctors, specialists especially, you know, post-graduation, post-MS or MCH neurosurgery. You know, we want to fast-track spine surgeons, and straight from MBBS now you can go into, you know, spine programs, neurosurgery programs, and you can become a doctor. But again, that comes with challenges. You don't spend enough time with patients. You don't spend enough time in the OR. You don't have the exposure. So that's now being changed. Like how a pilot sits in a simulator and does this many number of hours before he can actually fly a pilot. The technology is changing that, you know, the future of neurosurgery or spine surgery or orthopedic surgery, you're going to spend more time on simulators. And this is coming with various companies. We have come up with something called as digital surgery, which I've listened to a talk. And here this is also available in your mobile phone. You can look at the angle in which you want to place your T-lift cage, you want to plan your osteotomy in orthopedics, or you want to do a pedicle screw. All these things can be planned for your operating theatre. And what if your future is something like this, where you can just wear a lens and you're able to see the technology right in front of you. You can see the length of your screw. Through your lens, you can have multiple monitors where you can see your operating field, you can see your navigation, you can see your 3D image, you can take a picture, you can communicate with all this technology. So this is not far away, this is already there. This is already coming, this is already in use, already in trial phases, and this is already being used in many parts of the world. So this is what we are going to talk about today, where we have a range of speakers who are going to show you all this technology. So it's already there in Brain Lab. So you must be hearing all these words about AI, VR, artificial intelligence, virtual reality, augmented reality, machine learning, deep learning, robotics. So this is what's going to change the way that we do surgery in the future.